During the 8th Global Symposium on Health Systems Research in Nagasaki, Japan, the Alliance teamed up with the Asian Development Bank to mark the 20th anniversary of the Mexico Ministerial Summit on Health Research.
As Minister of Health of Mexico, I had the immense privilege of hosting that historical gathering. Since then, the Alliance has helped drive health systems research to new heights, increasing its volume, improving its quality, enhancing its visibility, and stimulating its translation. The core question we have to address now is how to sustain these gains in a changing global landscape, punctuated by the rise of populism and geopolitical polarization, challenges that have only deepened in the aftermath of the COVID-19 pandemic. These challenges should not dishearten us nor lead us to inaction. They should mobilize us as a community. One of the lessons of the rise of populism is that policy translation of health systems research should be directed not only to policymakers and technocrats, but also to grassroots organizations that can then defend positive policies from destructive attacks.
We need to continue to work together to support actionable health systems research that can catalyze evidence-based shifts in financing, in policy, and in organization of practice and care, and ensure health systems are appropriate to the context. Wellcome has been an active supporter of the Future of Global Health Initiatives process. Notably, this Lusaka agenda calls on the research and learning community to support robust and inclusive analysis through health systems and implementation research. So it calls on you. At Wellcome, we look forward to working with all of you to continue to accelerate progress and ensure the promises of the Mexico Summit and the Lusaka agenda are realized.
The past 2 decades unfortunately prove that human progress is most definitely not inevitable. And yet, we should be, indeed we must be, optimistic about the future. The global conversation about research in the world today has been transformed into a much more inclusive enterprise than it was 20 years ago. I believe that we now are much less willing than we once were 2 decades ago to tolerate the conduct of research for simply research's sake. Today, like never before, we see science as an instrument for social and political change. The spirit of Mexico 20 years ago was about achieving a parity of esteem between health systems research and biomedical research. Perhaps the spirit of Nagasaki today is about the intentional application of research to protect and strengthen our communities and the natural systems on which they depend. A prize that I think is certainly worth striving for together.